there are a lot of queries and fear and anxiety regarding how do we manage the second wave of COVID-19 as possible. I would be touching upon some of the aspects. For example, what are the waves of COVID-19 pandemic? And there'll be questions, if I've not been infected by COVID-19 so far, how do I prevent getting it? And then we would be discussing on how do we prepare and respond if one gets positive of COVID-19, and how do we manage? And last, if somebody is affected by COVID-19, how they should be recovering from COVID-19 and what one should watch out for. Pandemic. So we know that there was a first wave in last year, 2019, in the month of April. And we see a second wave which started in April 2020. If you look at the waves compared to India and US had a second wave in the month of January 2020. So what we are predicting is that we are going to have a third wave, possibly in the month of October, November. This prediction is mostly based on the epidemiological characteristics of Spanish flu that we saw in 1918 and 20, which characteristically had 3 waves during the span of 1918 and 20. From the experiences that we had during this Spanish flu, and we expect there would be a third wave as well. So what is the second wave is all about? Why this is so aggressive as compared to the wave 1? The aggressiveness and the severity of the disease seem to be much more compared to the COVID-1 wave, because it is mutated form of virus which has resulted in the second wave. And also there are several factors which has led to the second wave. For instance, the change in the human behavior. We are very cautious when the national lockdown was announced in the month of March and April. You remember, and all of us were locked down in the house. But as the disease was we felt like it is controlled, and our behavior also changed, and we became little laxed in terms of maintaining the social distance or wearing the mask. To add to this, we also had huge religious congregations and the marriages and the relaxation of masking and so on. I think this one, and also I personally believe that many people did not get the vaccine because there was a lot of vaccine resistance in the month of November and December when we introduced the vaccine. These several factors have led to the second wave in this April and May month. And Department of Social Technology is predicting that this second wave should decline by end of July 2021. However, we are not going to loosen up the lockdown measures. As per the WHO recommendation, countries can ease the restrictions only the positivity rate is less than 5% for at least 2 weeks. Currently, we have a positivity rate of 15 to 20%. Next slide, please. So what is this third wave is all about? As I mentioned in the previous slide, we have learned lessons from Spanish flu. And usually we predict that second wave is the harshest and third wave is expected to be milder. I'm speaking from the experience of Spanish flu. What we are also predicting that third wave could infect large number of children. Some hypothesis is that by October, November, at least 40 to 50% of the adult population would have got vaccinated. And children could be more vulnerable. And we're also predicting that this third wave in India could happen around 6 to 8 months. That falls between November and December, by which time we hope majority of us would be vaccinated. Next slide, please. So what are some common measures to prevent infection? So what I'm going to do is, first I'll talk about the prevention. Then I'll talk about a scenario that, okay, one is already got infected with COVID-19. What are the measures we should take? Then the third story would be what one should do after recovering from the COVID. The first is, how do we prevent this infection? Next slide, please. So first, let's try to understand what is the risk of transmission. Coronavirus, it's a simple virus, just like any common cold. It's a virus. But the problem is it attacks the lung tissue. So we need to really understand what are the risks for transmission. We have these housemates who visit the household daily. We actually think that if we go to the hospital or if we go to the crowded place only, we are going to get the infection. It's not so, and we tend to undermine several issues. And the interaction with the delivery boys, we do it quite frequently. Socializing without masking. Here I would like to emphasize on the practice of how do we wear this mask properly. So as you could see, many people wear the mask, but the nasal cavity is open. Then there is no use of wearing the mask. So wearing it correctly is also important. And young children who can contract the virus from their play group, because children may not exhibit the symptoms, but they may be carriers. And visit to the enclosed grocery stores. That is something we do very often. And I see many people not wearing the mask properly. And also if you have professionals in the family who work outside the house, who frequently go out. So these are the high risk population that we need to take care while we interact with them. Next slide, please. Here I would like to take you through the measures. Could you please go back? So it is unlikely to contract the virus from the thin air. So you need to have an infected person or a carrier to transmit this virus. So it is mostly through the respiratory droplets. That's why it becomes very important that you wear mask all the time. And we are calling it as an airborne infection because it is just there in the air. So unless you wear the mask, you are going to get it very easily. So in this context, what needs to be done is keep your house well ventilated. And the only thing, wear mask and maintain the social distance. And please consider any person that you meet as a virus carrier. When we used to do our medical school, so our professors used to say, those were the time when HIV was an epidemic. And professors used to tell us, treat every patient as an HIV patient. And we used to take all universal precautions. I think the same theory applies now. Whom you have met, you just presume that is a virus carrier, and please take utmost care wearing the mask and social distancing. Next slide, please. So there are multiple measures, but single measure is not foolproof. You see, you have mask, you have physical distance, hand hygiene, avoid crowded places, well-ventilated houses, quarantine and isolation if there is a COVID-like symptoms, and of course, vaccines. I'm going to take you through each measure in the next slides. Next slide, please. First, we need to at least understand what is our personal responsibilities. Masking, I said, preferably double mask when you move outdoors, and N95, which would actually cover your nasal bridge up to the chin. This is something you need to observe. Many people, only this nostril is covered and only the lip is covered. That is not going to protect you. So this has to be completely, it should be covered in the nasal bridge until the chin. And hand hygiene, please do sanitize your hands, and cough etiquette, which I'm going to talk in the next slide, and get vaccinated. Next slide, please. So what is cough hygiene? When you're sneezing, when you're coughing, please use a clean tissue and throw that tissue into the dustbin. If you don't have a tissue or a cloth, please use your elbow to do the coughing or sneezing, and wash your hands after you cough or sneeze. Next slide, please. So I come to the discussion of vaccination. I'm sure you will have a lot of questions on this subject. So Mrs. X has an allergy to pollen, and Mr. Y had a clot in the brain 2 years ago. Questions like this: should they be vaccinated against COVID-19? Next slide, please. Definitely, because this is not a contraindication to getting the vaccine. What are the do's that you should do while you get vaccinated? If you have any health condition, you need to inform your doctor prior to vaccination. It could be diabetes, it could be dizziness, it could be blurring of vision or hypertension. Please do inform your doctor. And take paracetamol. Please do not take any other drugs. Just take simple paracetamol 500 mg on the day and the next day of the vaccination. And what we are observing is the vaccination site has become a hot spot for spreading corona. There is like a huge crowd, long queues. So what we are suggesting is that please avoid those rush. And if at all you are going, please wear double mask and go. And if there are any side effects, please report to the person from where you got the vaccination. And what are the don'ts that you should do when you get vaccinated? Please don't spread any fear or panicky about vaccine side effects. There are some side effects, but there's a very, very rare situation. And please do not forward any WhatsApp messages unless it has been verified. And as I told you, please avoid crowding at the vaccination sites. Next slide, please. So what is the vaccine regimen that has been prescribed by Government of India? There are two approved vaccines for Government of India. One is Covishield. This is the Indian name for Oxford or AstraZeneca vaccine. It is manufactured by Serum Institute of India, located in Pune. And the gap that is suggested is 12 to 16 weeks between the two doses. Covaxin, it is an indigenous vaccine from Bharat Biotech, Hyderabad. And the gap suggested is between 4 to 6. So let's please understand why we need to have this gap between the first dose and the second dose. When you get the first dose, your body will recognize those antigens, the viruses which have come into your body, and they will start producing the antibodies. And then slowly that virus wanes away from your body. You have some amount of antibodies which are produced in the body. If you give some gap, what is 12 to 16 weeks for Covishield and 4 to 6 weeks for Covaxin, your antibodies will be ready. Then you give the booster dose and their memory will become very, very strong. Please remember this time interval, which has been fixed for this particular Covishield or Covaxin, needs to be followed. Otherwise, your vaccine efficacy will be compromised. So it's a human mechanism. Antibodies are produced in the first dose. When you give the second dose, they become much more mature and their memory gets strengthened so that they are ready to fight the COVID when you are exposed. And the third one is a Sputnik. This is imported from Russia, and it is received on an emergency approval from the CGI, and it's a single dose is sufficient. Apart from government hospitals, Apollo and Manipal are also procuring some of the vaccines directly from the manufacturers. And the last important thing that I would like to highlight is if somebody has recovered from COVID, they should take vaccine after 3 months because they would have already got antibodies when they have infected with COVID. So they should give a time interval of 3 months and then get themselves vaccinated. Next slide, please. So people ask me questions. I know people who took vaccine but still got COVID-19. Do vaccines work? Next slide, please. So let's say I take first dose of vaccine today, and I need to have 1 month of period to develop that antibodies. And these antibodies after the first dose is not complete. It's not foolproof. I have some antibodies, but it's not, my body is not ready to fight the virus completely. In the month of, I take today, today's 29th May, and next 29th June, I may get exposed to the COVID, I may get COVID. But that doesn't mean that first dose has not worked. It is that I do not have sufficient antibodies. So people are under the misconception that, I took vaccine, but I'm COVID positive. To get that sufficient protection, you need to have first dose, give a time gap, get the second dose, then after that, after 2 months, your body would be ready to protect from the COVID. So it is essentially from first dose to second dose to your body is ready. It takes like 4 months to get yourself protected from the COVID. So if somebody asks, no, I took COVID vaccine, but then I'm COVID positive, you need to ask, when was that first dose taken? So I come to some of the studies. So India data, which looked at the severity of the COVID infection post 2 doses of vaccine, is being critically analyzed. What we found is those people who have received 2 doses of vaccine, the severity of the infection is very, very less. In fact, Narayana Hrudayalaya did a quick survey. They did not have any patients coming to the ICUs who have received 2 doses of vaccine. Scientifically, post 2 weeks of second dose of vaccine, that means after 15 to 20 days, the severity of the infection is less as compared to person who has not received any vaccination. So I would repeat, even with a single dose of Indian vaccine, you will get some protection. But to get the substantial protection, you need to have first dose, leave it for 1 month or 2 months, then they take the second dose. After 2 months, you will have full immunity. Next slide, please. So when do we test for COVID? So all this, I was talking about the prevention. Now you have symptoms, what we should do when we get the symptoms. Next slide, please. Fever, cough, sneezing, fatigue, loss of taste or smell, difficulty in breathing, even just a tiredness. I have seen patients coming with conjunctivitis. They turned out to be COVID. I've seen patients coming with loose motions. I've seen patients coming with vomiting. That turned out to be COVID. So for all practical purposes, during this pandemic, at least in next 1 year, if you have any illnesses, please do consult your doctor and explain this is what is happening. It could be COVID. Next slide, please. So what are the tests available? We have one rapid antigen test. We also call it as RAT. This is more of a screening. No? You just do it quickly and then you get the report in 1 hour. But this is not 100% proof. Then you will be subjected for RT-PCR, that is real-time polymerase chain reaction, where your sample is extracted and the DNA is looked into. So it gives you the quantity of how much you are infected. And this is a golden test. So these are two tests available. And we also do antibody test that is mostly for the public health action or the research purposes. Apart from this, now what we are seeing in the second wave, the patient is RT-PCR negative, but then the patient is showing all the signs of COVID. So we are trying to correlate with the blood tests. There are some blood tests that we are doing, complete blood test, and then we are trying to correlate with the COVID symptoms. So this has become a little trickier because the RT-PCR is negative, but then you have all the symptoms of COVID. So again, I repeat here, even if your COVID, even if your RT-PCR test is negative, if you have COVID symptoms, please do not hesitate to consult your doctor again and again and tell them, I do have these symptoms, and they will correlate with the blood tests. Next slide, please. The next question I've been asked is, should everyone with COVID-19 get a CT scan done? And what is a CT score? Next slide, please. Not everyone with COVID-19 needs a CT scan. If you have chest symptoms, like if you have a lot of cough, difficulty in breathing, then we subject them to the CT scan. If you have minimal symptoms, if you are COVID positive, if you have minimal symptoms, you do not require CT scan. If you have chest symptoms, then we do CT scan. There is something called core RATS rating. If this is more than 5, it indicates COVID. And if it's more than 8, it requires hospitalization and treatment. However, it needs to be correlated with your symptoms and also other blood report tests. Next slide, please. So this is about your diagnosis and test. Now, how the COVID has come, now how we need to be prepared and fight it out. Next slide, please. First, preparation is the key. We all of us know the COVID is there everywhere, and we need to be prepared. Irrespective of whether we have COVID cases around or not, we need to be prepared. First, keep 2 to 3 months stock of your regular medications. It could be thyroid, it could be diabetes, it could be blood pressure. Just keep the drugs handy. And it's been told again and again, having a good immunity is the only weapon to fight COVID. And having a good immunity will not happen in a day or two. You should have worked for it several years. So having a healthy diet, mostly the green vegetable, raw vegetables will give you good immunity, sprouted pulses, dry fruits, good sleep, and exercise. I think if these 4 things are taken care, I think in a long run, you'll have a good immunity. Please monitor your sugars, blood pressure at home, if you are diabetic and hypertensive. Please keep thermometer and pulse oximeter ready at your place. And please do not watch television. This news, scary news, actually breaks our morale. There is no need. I think we have newspaper. I think that's enough. Just keep it there. If you really want to keep updated with the news, please do not watch this TV and this scary videos. And at least for me, what has helped is that, when you help people in need, even you need not physically be there, just to listen to the other people, which also helped oneself. At least for me, it has definitely helped. And do not take any medications off the counter to prevent COVID-19. It doesn't work. None of the medications work. Please consult your doctor. And please do not forward any unverified WhatsApp or social media content. Next slide, please. So what do we do when somebody is diagnosed with COVID? Next slide, please. Yourself or any of your family member is infected with COVID and has been managing at home. These are the 3 things you need to remember. One is early COVID. There are minimal symptoms, just fever, little headache, little body ache. You need not do anything. Just get the home oxygen probe, keep testing the oxygen saturation, drink lots of water. Viruses gets flushed if you drink a lot of water. And then just use simple paracetamol. Don't take any painkillers. Nothing is required. Just take simple crocin and wear mask if any of your family members are infected. Wear the double mask. What if saturation is more than 92%? Nothing to worry. Just take paracetamol for fever, hydration, water, and if you think that the breathing is becoming little strenuous, maybe you can go for a steroid inhalation. That to 2 puffs twice a day should be fine, and nothing else. If oxygen saturation becomes less than 92, I think that is something where you need to act under the supervision of a doctor. Home oxygen, if it is available. Dexamethasone, this time you'll have to take orally. Keep checking oxygen saturation. Keep yourself hydrated. And if you think that they are getting a lot of cough, then only please go for antibiotics. Otherwise, there is no role of antibiotics in the COVID-19 management, because COVID is a virus, it is not a bacteria. So antibiotics will not help. Next slide, please. When you're in the home isolation, as I told you, monitoring temperature is the key. If the temperature does not for after 5 to 6 days of symptoms, I think you should consult a doctor. And saturation less than 92%, we need to hospitalize. And whenever you take a oxygen saturation check, please ideally walk for 5 minutes and then test the saturation. And preferably the middle finger should be used for pulse oximeter. Next slide, please. So as Rashmi was saying in the introduction, what is the difference between the symptoms in the first wave and the second wave? In the first wave, there was an early onset of fever. For at least after a week, you would get the fever. But here, you get the fever, high fever, immediately after the infection. And if you look at the amount of virus in the blood, in the second wave, we are seeing viremia. When I say viremia, it is the presence of virus in the blood is higher in the second wave as compared to the first wave. That means to say the severity of the symptoms will be more in the second wave compared to the first wave. And the trickiest part is you may be RT-PCR negative, but still you're carrying the virus. And sometimes there is a blood test, it looks like normal, but then your lungs are severely compromised and you have a difficulty in breathing. Also, what has happened in the second wave is people have started using steroids left and right, indiscriminate use of steroids. That has led to lot of other opportunistic infection. I'm sure you would have heard about fungal infection. Fungal infection happens only in such individuals where immunity becomes very, very poor. This is mainly because indiscriminate use of steroids. That needs to be avoided completely until it's called for. Next slide, please. I repeat, if you do not have any symptoms, please stay at home, use pulse oximeter, wear mask, keep your house well ventilated, let the fresh air come inside the house, stay home, keep yourself hydrated, just take paracetamol and some multivitamins, and please expose yourself to the sunlight, both morning and evening. Make it a habit that you expose yourself to the sunlight. And I told you what you need to do if the oxygen level is more than 92% and what you need to do if it is less than 92%. And I repeat, no antibiotics has a role in COVID management unless the person has a secondary bacterial infection. So please do not overload with patients with a lot of antibiotics. It doesn't help. Next slide, please. How one should look at the worsening symptoms of COVID-19. Oxygen saturation, if there's a chest pain, tightening of the chest, shortness of the breath, if you're not able to hold the glass, feeling weak hand grip, unable to speak full sentences where you need to take 2-3 breaths, there is a mental confusion, there is a dizziness, and if your extremities hands and toes starts feeling cold, these are the worsening of the symptoms, and you should seek help immediately. Next slide, please. We need to be vigilant in some of the category of the patients, especially immunocompromised patients who are on HIV treatment or who have got the organ transplantation, because they will be mostly on steroids, and also the cancer therapy patients where the immunity will be very, very less. So you need to really watch out for COVID symptoms. And the pregnant women where the immunity will be less, they need to be vigilant. And if people have these comorbid conditions like kidney disease or heart disease, diabetes or asthma, or smokers, or person who have already had tuberculosis, so these are the people who need to be very, very vigilant for looking for COVID symptoms. And of course, if as I told you, if you have not taken care of your health in last couple of years, if your hemoglobin is less, if you are malnourished, the chances of getting the infection is more. And also, if you are living alone, if you are disabled, these are the high risk factors, and you should consult doctor without any delay. Next slide, please. So now I'm going to take you through how a person who is taking care of the COVID patient, what are the precautions that that person should take. So if there is a patient in the house, please assign one member to take care of that patient. So that person should take the whole and sole responsibility. And every time you serve food, open the door, please wash your hands and sanitize the door locks. And the person who is taking care of the COVID patient should stay home and not come out. And whenever that patient nurses that COVID patient, please wear the face shield, glasses, and the mask. And please maintain the social distance while you take care of the COVID patient. And keep the surfaces and the surroundings of the home clean using the sanitizers frequently. Next slide, please. So one has got COVID, and now that person needs to recover. What should one watch out for? Next slide, please. So this is one handbook I would be sharing with the organizers. You can reach out to them. This is a very nice book from Johns Hopkins, which gives you how to bounce back to the normal life. It gives a breathing exercises. It gives a very light physical exercises. Slowly you can bounce back to your normal life. This I'll be sharing with the organizers that you can get access. Next slide, please. And what we are also seeing that when the people go back after recovering from COVID-19, especially the hospitalized patients, we are seeing the fungal infection. This is mostly due to the overuse of steroids. That is the preliminary research findings are suggesting. And you need not worry, this is mostly happening with the people with uncontrolled diabetes mellitus. So one needs to, my suggestion would be, first avoid all possibilities of getting exposed, use mask, maintain the social distance, get yourself vaccinated, and hand hygiene. This COVID is going to be with us till the end of 2022. This is how all the pandemics have behaved in the history. Even though the curve would flatten by mid of next year, let's be vigilant and maintain the same behavior until end of 2022. Next slide, please. Here I would like to also emphasize on no one is safe until everyone is safe. So we need to take care that our supporting system in terms of maids or in terms of drivers, in terms of housekeeping staff, everyone needs to be tested for COVID, and also everyone needs to be vaccinated. Until unless they're vaccinated, we are not safe. So it is like, it's not only the supporting system, it's everyone. So we'll not be safe until everyone is safe.
From Daisy, as it is aerosol transmission, it may be a bad idea to visit the dentist. So do you want to throw any light on that?
Yes, Daisy, I think it's better until unless it's an emergency. Please do avoid going to dentist or any health facility for at least till the end of July 2021, because this will taper down. So just avoid that.
So Mr. Desikana said, I thought Sputnik is also double dose. Is there any doubt regarding that? Would you like to clear that?
Yeah, because this has not been, efficacy has not been tested in Indian population. For now, it's a single dose, but this would be reviewed.
Okay. The other question is, what if we have taken the second dose after 6-7 weeks, as that was the advice at first? So what can happen if that has been done?
There's no damage as such, only thing, again, I would say this is very individualistic because every body reacts in a different way. If the Covishield is taken, we say at least 12 to 16 weeks. If it is taken, it's not a damage, but maybe the production of antibodies may be a little compromised, but the protection will remain the same. So you need not worry.
Okay. Season changing time, do we get sneezing, cold and cough? So how many days should we wait before we ask for an RT-PCR test?
Why we are seeing a lot of fatality in this second wave?
Sure.
Because many people are not getting themselves tested. They think, we will take steam, we will drink some kashaya, and within a span of 2 to 3 days, their health becomes so compromised. So when we know that this virus is so aggressive in the second wave, why should we even wait for a second or a third day? You have fever, please go and get yourself tested. Vaccine is the only tool with which we can fight this pandemic. And as I told in my last slide, and we can't be safe until everyone is safe. So we have to get this vaccine. Otherwise, we will not be able to fight this. And let me tell you from the global perspective, the developed countries have already accumulated so much of vaccine that they are capable of vaccinating all their population. And they've also accumulated so much for the next year also. But if you look at the African countries or any developing countries, even 2% of the population is not vaccinated. And we are now advocating for vaccine equity, because it's not about the nation, it's about it's about different nations. Any person who is coming from the other country, they can bring in the virus. So people from developing countries, from the underdeveloped countries, we are asking the developed countries to help to get the vaccine, because we won't be safe until unless all the countries are safe.
Okay, would vitamin D supplements help, as most of us are mostly indoors these days?
Yes, definitely. Vitamin D is something you need to take. I'm sure most of your people would be taking the supplements. On top of it, I would also suggest to have sun bath in the early morning and in the evenings. That really helps, because even when you take the supplements, the body needs to process that supplement, for which sunlight is required. So only the supplements will not help you, but you will have to get yourself exposed to the sunlight as well. Sit in the balcony, sit in the garden.
Okay. So here's a question which may help to clear any misconception. Some say that if you do not get any reaction after taking the vaccine, your immunity is not complete. Is this true?
No, no. It is very individual dependent. Some people get fever, body ache. Some people, there is no reaction whatsoever. So it's very individualistic. It is not correlated with your efficacy of the vaccine.
And then there's another question on which is the better vaccine to take between the currently available vaccines. Or would you like to clear any doubts? Because people seem to have a lot of doubts about the vaccine. So
There is no difference between any vaccine. Please take whichever is available as soon as possible. All the vaccines are tested for their efficacy and they are proven efficacious.
okay, so many people want to know what is the advisory for people who have been vaccinated as per the earlier guidelines when the Covishield guidelines were 6 to 8 weeks. And, they may be, their turn may have come according to the current guideline, according to the previous guideline, but right now they're advised to wait it out. So what would your suggestion be there?
Please wait for 12 to 16 weeks. So that's what has been told for Covishield. We are also evolving as we are learning about this virus, right? And what we are seeing that 6 to 12, 12 to 14 weeks is something will give a more immunity. So please wait and follow the current suggestion.
So there is another question on the delay in the results of the RT-PCR test. So even if you get tested, your results may come only after 2-3 days. So in that case, what do you do if you have fever or anything? What do you do then?
You start taking the paracetamol, as I said, multivitamins, keep yourself hydrated, steam. So the normal things that you keep doing. The role of antibiotics is very, very limited. So don't offer any antibiotics on the first day itself.
People having fever after 2 vaccines, after the 2 doses, if the RT-PCR is negative, but they still continue to have fever, is there a chance that it is COVID?
Oh yeah, it could be. So I'm saying that, when I'm advocating for vaccines, it's not 100% foolproof. So I'll give you the example of BCG. All our children have got BCG. BCG will protect the child from the meningeal tuberculosis, brain tuberculosis, that too in the first year of life. But it will not protect the person in the adult TB. So likewise, this vaccine will prevent the severity of the disease. You will get infected for sure. If you are getting exposed to any carrier, you will be infected, but the symptoms will be minimal. You won't be hospitalized.
Right. Preeta has asked, can you please explain herd immunity?
Yeah. So I'll take the example of polio. We used to give polio drops. This is for all the vaccines. I'm just taking the example of polio vaccine. So when the child gets that polio vaccine, it gets into the intestine, and then it is passed in the stools. So somehow when the other children or the other people, they consume it, it's a dead virus. It will produce an infection, but it's not lethal. Same way, the COVID infection, if I'm vaccinated today, I have viruses in my body, but it is not so strong to produce a disease. But I'll be carrying the viruses. So I'll be spreading some viruses, but they're all dead. So if the person gets exposed to me, they will get infected, but it's a very, very minimal virus that gets into the body. So we call this as herd immunity. That person is exposed, but not completely immune.
Right.
So when we say at least 60% of our population is vaccinated, we presume at least another 40% population will get the herd immunity.
So steam inhalation is something many people are doing. Is that really effective? And is it required?
Okay. I think steam inhalation is something people are overdoing it. Um, Ideally, if you have cold, if you have heaviness in the head, maybe morning and night should be fine, even in the afternoon. But what I'm seeing is that they are taking the steam inhalation for 5 to 6 times. You know what's happening? Your nasal mucosa is getting hurt. It's just like lip. Huh? We call it as mucous membrane. It is just like a lip. So if you keep um, exposing it to the heat all the time, it tends to break. And then I have seen a lot of patients coming with bleeding also, because your mucosa just gets so much dried. So 3 times a day, that should be sufficient. And I would strongly suggest to put ghee or coconut after taking the steam. That will keep the mucosa soft. Just like you apply lip balm, you need to take care of your nasal mucosa as well. As soon as you take steam, please put ghee or coconut oil.
Okay. What about pranayama and Brahmari breathing? Those were also advised. Do all these things help, and are these required to be done on a regular basis if people are able to?
Definitely. With no doubt, these pranayama, chanting definitely will help you, because it expands the lung. So this is more of your lung exercises. Please do continue with or without COVID. These are all the lifestyles one needs to adopt, irrespective of the age. It will definitely help.
Okay. One last question about fitness. People who are very active outdoors and do fitness exercises, do have a fitness routine outdoors. When could they renew it? And also about, whether to stay masked or unmasked at that time.
Okay. Outdoor activities should be avoided, and at least mid of July. Let the curve come down, let the cases come down, because as I said, at least the positivity rate should come below 5%. Then I think we'll be safe. And if you're going outdoor, please do not wear mask, because there are several instances when you start running, when you wear the mask, you will not get the sufficient oxygen, which is not good for health. Rather, I would suggest that you do some physical exercises, skipping inside the house, and avoid going outside till mid-July.
Okay. And even if someone wants to do a brisk walking, which many seniors do tend to do, so that is also absolutely avoidable outside with a mask.
It depends, Rashmi, because if you're in a crowded place, then it should be avoided. If you're in an apartment where you have a huge space and it's not crowded, well, you can go out.
Okay. And do you walk while being masked or without?
A thinner mask should be helpful, because if you wear a thicker mask and you walk briskly, I don't think you'll be able to cope up with the oxygen levels.
Okay. Okay.
Interacting with you all. I look forward, if there is any questions, I would like to take it up through the emails. Thank you so much.
Thank you.